When you do that, that's when the body can naturally start healing itself. Hey guys, I'm Dr. Korey Rose at Rose Family Chiropractic and here in New Braunfels, Texas. Why don't y'all come on in my office today and I'll show you what it's like to be in the day in the life of a chiropractor. So in my practice, I have Rose Family Chiropractic in the name. Not only are we a family here with the staff, but I really consider my patients family. We don't give a cookie cutter treatment plan to every single individual. I'm going to treat every single patient as an individual with individual specific conditions. And even if I have one individual that has condition A and another individual that also has condition A, the treatment plan for those two individuals may be very different. Have a great day, Miss Ashley. I'll see you in 4 weeks. So that was a standard routine maintenance adjustment. I don't recommend maintenance on every single patient, but some patients have structural issues that could use some attention on the routine. But I really enjoy what I do. I like the personal one-on-one relationships that I get developed with my patients. The beauty about chiropractic is we tend to see our patients a little bit more frequently than almost even their GP or other types of specialists. So we really develop a lot of rapport and personal connections with our patients. So usually it goes beyond just, hey, I'm here for this condition, so fix that and then I'll be gone. Hey, Miss Abriana, how are you today?
How are you?
Good. You ready to get to work? Let's get to go. This table's great for individuals that have difficulty climbing onto a table.
Yeah.
Yeah, the mindset of treating these types of injuries has changed so dramatically over the last 20 years. The mindset used to be just rest and let it heal. Yeah, that's gone. The faster movement is life. The more you use it, the better it'll be. If you don't use it, you're gonna lose it. But essentially that's what chiropractic does. We restore movement, function to tissue, and when you do that, that's when the body can naturally start healing itself. You see how much better that's moving? It's nice and it's less tender than when we started. More is moving. That's because we have more mobility, less inflammation.
Thank you so much.
Have a great day. I'll see you Friday, okay? Hello, Miss Angela. So less severe symptoms. Have you noticed some improvement in the mobility of your neck?
Yes.
Okay. The pain in the arm, how's that doing?
Better.
Is it happening as often?
No.
Is it going down the arm as far?
No, it's actually, I haven't had any.
Oh, really? Great. Okay. So that means the inflammation at the herniation, the site where the disc herniation is putting pressure on the nerve. That inflammation has reduced to the point where we're not putting as much pressure on that nerve, which is why the symptoms in the arm are not as frequent or as severe. Okay. So again, you get micro traumas to these tendons and these muscles, and your body's going to heal them with scar tissue. And if you think that, well, I'm just going to sit back on the couch and pop ibuprofen and it'll get better with time, what's going to happen is you get this injury and then you have limited mobility. Your body's going to start healing this injured tissue with this scar tissue, and it's essentially that scar tissue is going to glue you into a limited plane of mobility, and that scar tissue becomes very sensitive. A lot of neural tissue will grow into it and it makes it very tender, which leads to chronic pain. So early at the onset of these types of injuries is the time to fully rehab those to give you the best chance of not suffering long-term effects. Very good. Next slide, please. Very good. See how much more that moved compared to the last time?
Yep.
Alrighty. Well, we are done for today. I'll see you Friday. Have a great day.
You too.
So this is a spinal decompression table. We utilize it for necks, low backs to decompress the spine. A lot of times when a patient has a cervical disc herniation, the neural foramina, which is the hole in the side of the spine, is kind of occluded a bit and doesn't allow the nerve enough room, so the nerve gets pinched. So what this machine does is it slowly and gently distracts the vertebral segments, and it opens up that space for the nerve and allows it to get a little bit of room and hopefully promote a little bit of healing in the recovery process. So this is the Shockwave machine. It's an extracorporeal shockwave therapy machine. What it does is it stimulates residential stem cells and modulates an inflammatory response to actually get tissue regeneration and healing through neovascularization or angiogenesis, which is the process of new blood vessel growth. We're seeing some amazing results with this, especially in the extremities, plantar fasciitis, Achilles tendonitis, degenerative knees, rotator cuff problems, golfer's elbow, tennis elbow, really phenomenal results, but very high success rates. So I spend a tremendous amount of time on the computer charting records, specifically formulating treatment plans for patients, charting every day-to-day notes, progress, lack of progress. Do we need to make a referral? Are we co-treating? Making sure I'm keeping up communication with the other treating providers. I spend well over half my day doing that. I'd much rather spend more time one-on-one with patients. Hopefully one day AI can improve the charting aspect of not only just for chiropractors, but I think for all of healthcare. I think I was really lucky I was able to buy this building. I was renting for so long, and to get out of the rent race was really nice. And the location's great because Christus is right there. My old office, like, it was the concrete jungle. Where there wasn't concrete, it was asphalt. And I mean, you could hear cars and horns and all that stuff. Here it's set back in a bunch of trees. You know, if you really listen quiet, you can hear birds chirping. It's kind of nice. In the long run, my patients' well-being and the outcomes of my patients is at the foremost of my concern. If you take care of the patients, they're going to take care of you. But one thing that really has worked for me is not only do I work with other healthcare providers such as primary care physicians, pain management doctors, surgeons like Dr. Webb, I also communicate and establish relationships with other chiropractors in my community, because a case that is more in tune to the services and the style of practice that I have, I might be a better fit for that patient, and I get referrals from other chiropractors very regularly. Thanks for coming out, guys. I hope y'all learned something about what it's like to be a chiropractor. If anything in this video intrigued you, or any of the conditions that I may have mentioned you may have and you're in the New Braunfels area, you can reach out to us at rosefamilychiro.com, or you can call us at 830-629-3101. Thanks.